We have in the studio Dr. Tochi Okwo. She is the acting head of Department Disease Prevention and Health Promotion, NCDC, to talk to us. Dr. Tochi, thank you so much for joining us on the news.
Thank you for having me.
Thank you so much. Now, so what is the current status of the disease around the world, and Nigeria in particular? Any reported outbreak in nearby African countries?
The current global situation of this human metapneumovirus is that it is currently circulating with high transmission rates in various parts of the world, particularly around the country you have mentioned and in some parts of Europe. However, for Nigeria, where we have what we call a surveillance system that tracks the respiratory illnesses, we haven't noticed any rise or increase in numbers of febrile respiratory illnesses. So for the Nigerian situation, as we are monitoring it and tracking it, we do not have rise in cases. We do not have cases in Nigeria as our data currently suggests.
Okay. So now, for the sake of our preparedness mechanism, what are the symptoms for this virus?
So the symptoms for this virus are the symptoms you get for the common cold.
Okay.
The cough, the sneezing, the sore throat, fever, and the symptoms are actually severer in very young children, the neonates, and also in older people. Also in adults that have reduced or compromised immune systems,
okay,
such as individuals that are maybe receiving cancer treatment, their immune system may be reduced. People with uncontrolled or poorly controlled chronic illnesses such as diabetes, their immune system may predispose them to having severer disease. And in those cases, it can then move on to pneumonias and a bit more severe.
Okay. Is this similar to COVID-19? Are these symptoms similar to that of COVID-19?
Generally, the symptoms are similar. They're all respiratory illnesses.
Okay.
Yes.
Okay. So what are precautionary suggestions you would give to our citizens starting with hygiene?
So the precautionary measures are actually what is very, very important. The preventive measures. Because these things are respiratory in nature, it means that when we are coughing or sneezing, we increase the chances of transmitting them. Therefore, maintaining what we call respiratory hygiene and cough etiquette. Okay. So when you sneeze or cough, you be sure to cover your mouth and your nose either with your elbow or with a tissue, after which this such tissue should be properly disposed and then the hands properly washed. And then hand hygiene is the fundamental of prevention. We must make sure that we imbibe that culture of constantly washing our hands. Whenever we are outside of the house, we come in, or all those moments we know that we must wash our hands, we must now make sure we do. Cleaning the surfaces, environmental hygiene, avoiding crowded environments. And when an individual has symptoms at the time to be moving around everywhere, it will be good to take such precautionary measures. And remember, we had mentioned that the very young and the older population. So where do you find very young people? This is the time that baby care centers, the daycare centers, anywhere where we think vulnerable populations will aggregate, they have to improve their index of suspicion. They must improve environmental hygiene. This is not the time to take a sick child to the daycare center because you have a lot of young children aggregating there. Maintaining such very simple basic measures would keep everybody safe. There's also the part of healthcare facilities where we must now improve our infection prevention and control measures.
Dr. Tochi, I want to thank you so much for enlightening us. Thank you very much. We do appreciate your time.
Thank you for having me.
Thank you.